Fabiano, and I'll teach you about arthritis. Arthritis is chronic inflammation that has led to permanent degradation of the cartilage in a horse's joints. This means the articular cartilage, a certain type of cartilage that lines the end bones where they meet to form a joint, such as the knee or hock, is deteriorating. Arthritis can appear in a few different ways. The horse will walk with lameness and stiffness, or the joint may be swollen and warm to touch. No matter what you see, you should call your vet out to double check because you're going to want to develop a plan to manage arthritis. Notice how I didn't say cure, I said manage. Unfortunately, arthritis doesn't have a cure, but there are steps you can take to provide your horse with maximum comfort and increased performance. A lot of people want to know, is my horse at risk? Yes, all horses are, especially those that ride at higher levels of performance, such as jumping, reining, or country horses. It can also occur more frequently in horses that have injuries or horses with poor conformation. Arthritis is believed to be responsible for about 60% of lameness in horses. Arthritis is most commonly found in the knee, fetlock, coffin, hock, or pastern. This is my horse Erin. She has arthritis in her neck, back, her legs, especially in the back. She's 28 years old now, but we bought her at 21 knowing she had pretty bad arthritis, especially in her back legs. Her history is that she was a jumping horse that wasn't maintained in the best muscling physique when jumped, which is why it's important for your horse to be conditioned and muscled when you're performing more intense work. For example, if your horse tends to be out of shape in the winter, limit the amount of jumping or heavy stops. You can see how Erin's joints and her vertebrae are a little inflamed and they stick out from her back a bit. Sometimes when I stretch her neck, I can also hear it crack. When I pick out her hooves, especially her back, she does a little stretch. There is no way to prevent arthritis, but you can manage it. So first of all, your vet may recommend a medication or supplement to start feeding in their grain or orally. These medications may include ingredients such as glucosamine, which inhibits the enzymes that break down the cartilage, and chondroitin sulfate, which stimulates production of hyaluronic acid and proteoglycans, which also inhibits the breakdown of cartilage. In severe cases, you could get a surgeon to fuse the joints together. Science aside, there are a few things you can do to help your horse. If possible, keep riding. The goal is to keep your horse moving to improve circulation. Erin is now retired, so any bit of trotting around the pasture in hand is good movement for her. With that being said, horses with arthritis should be turned out as much as possible. Keep an eye on your herd's dynamic as well. My other horse, Bowen, will push them around a bit and sometimes initiate random group running. This is good movement for Erin and her arthritis to boost her circulation, but you don't want to have your horse be pushed too hard to the point of lameness. Make sure your horse's enclosure isn't too rocky either. Any hills or rough terrain could cause lameness as well. There are some stretches you can do to stimulate movement. The first stretch is to start with neck exercises. Use a treat as motivation and bring their head around your body. You may hear a couple cracks, but that's okay. And then give her the treat. You're going to want to do the same for both sides. The next exercise is to pick up all of their legs and just give them a little bit of upward stretch. Do it to all 4 of their legs. In the back where her arthritis is especially bad, when I pick up her leg, you can kind of see how she brings it up and stretches it a little bit by herself. You can just hold it there for a second. Some horses with arthritis will kick out a little bit, so just be careful when you're picking up the legs. The next step is to walk them in circles. After you walk them, you can move up to trotting. If your horse is comfortable trotting, you can throw them on a lunge line and maybe go for a little bit of cantering. Just don't push your horse too hard. Walk a little bit. Obviously, arthritis will have some sort of play in the level of their performance, but it shouldn't affect the outcome of their life expectancy too much if you manage the symptoms well.